We are working right now to gather some more details about this second case now of Ebola virus that has been confirmed.
And Dallas County Health and Human Services Director Zach Thompson joins us live on the phone. Good morning, Zach.
Good morning.
What can you tell us about this patient, if anything?
Well, we don't know specifically any information on the patient. We're waiting on, I'm sure, the press conference at 7. What we do know is that a second healthcare worker has tested positive for the Ebola virus. We want to remind Dallas County residents not to panic and overreact. The hospital is tracking their specific employees, so we just want Dallas County residents to stay calm.
Zach, we've been told over the past couple of days that although the health department was monitoring people and monitoring contacts for symptoms, that nobody was showing any. Can you tell us when this patient first started showing symptoms? Was it in the last 24 hours?
Well, I want to clarify. Dallas County Health and Human Services, CDC, are tracking the initial 48 contacts of Mr. Duncan. These employees are Presbyterian Hospital. We're tracking their own employees. So this is a new contact list of 76 employees. And so the 48 that we've been tracking today have not shown any symptoms.
Okay, and Zach, thinking about that initial 48 that grew from the family members who were first exposed to Thomas Eric Duncan, now we have this new pool of potential patients. Again, we're keeping things calm in terms of, we don't have anybody else showing symptoms, but how many isolation rooms are there at Texas Health Presbyterian if indeed we need to put more potential patients in isolation?
Well, that's a question for Presbyterian. I'm sure at the press conference at 7 they may go into that in terms of details. I think the CDC, by the fact that they're on the ground, they have a robust physicians that are assisting the hospital. I think those determinations in terms of where to move patients, if needed, will be determined at that time. But right now we only have 2 confirmed cases at this time. And so we don't know if there'll be additional cases, but let's not be surprised.
Has the process of finding more contacts of the second patient already started?
Oh, I'm sure it has. But again, and that's why I want to separate the initial 48, that's being tracked. We have contact investigation with those individuals. And so the hospital is doing the contact tracing of their hospital workers.
Zach, just in a broader picture, every single person so far diagnosed in the U.S. has either been from Liberia or has worked with someone, as far as a healthcare worker, with someone who was from Liberia. There's always this connection to West Africa. How are you and your department balancing an abundance of caution and calming the public's fears? This has to be a very tough job for you guys.
Well, I think the key point is that our hospital workers, we have to protect our nurses, our physicians, and so we have to look at the protocol. And CDC is working on revisions or have put in place interim protocols. So that's going to be the key result from this whole process, is to make sure we have the correct protocols in place to protect the healthcare workers. You have to trust what they're saying, and you've got to make sure you're protecting them.
Zach, if you're telling us that the hospital has been tracking its own employees, and we have 2 cases now that developed at the hospital, at what point do you reach the criteria where the health department and the CDC steps in to take over that monitoring process and the contacts of those people who are at the hospital?
Well, and I'm sure that's a decision by the CDC, since they're the lead in this investigation at the hospital. But our staff is aware of what's going on. But again, the monitoring early on was set up through the hospital for their employees. And so as we move forward and find out information, they'll tell us how they need Dallas County Health and Human Services to support them in this contact tracing.
All right. Well, of course, we all want our healthcare workers to stay as safe as possible as they have the tough job of monitoring these cases. Thank you so much, Zach Thompson, joining us live on the phone this morning.